Now we'll see the antibiotics that act on the 50S subunit. Now, whenever you hear the word chloramphenicol, remember it's a very great antibiotic with a wide spectrum of activity, but with a limiting side effect, that is bone marrow suppression. It acts by binding reversibly to the 50S subunit and inhibiting peptidyl transferase, thus preventing the peptide bond formation between the upcoming amino acids and thus inhibiting protein synthesis. By inhibiting protein synthesis, it is bacteriostatic, but at high concentration, it can also act as a bactericidal agent. Chloramphenicol can also act on the 70S subunit of the mammalian cell ribosome and thus inhibit mitochondrial protein synthesis as well. As I said, chloramphenicol has an enormously large spectrum. Now, it was used in the past for a lot of different diseases, but now it is only used as a backup drug for typhoid, bacterial meningitis, anaerobic infections like Bacteroides fragilis, and in those cases of rickettsia, which are in children or in pregnant women, because doxycycline will be contraindicated in these cases, right? And also in brucellosis when you cannot give tetracyclines. It is also used topically in ear and eye infections. And in these cases, the systemic toxicity will be minimized. Regarding the pharmacokinetics of chloramphenicol, in the very name we can see phen, Phen. That means it has a phenyl group. Now, phenyl group we know is lipid soluble. So remember all the properties for lipid soluble drugs. It can be used orally. It has gut absorption. It can be used IV and topically as well. It crosses blood-brain barrier, also blood CSF barrier, placenta. It is also secreted in the milk, and its metabolism is in the liver, where it is conjugated with glucuronide and then excreted in the urine. Now, one thing to remember is that it is an enzyme inhibitor as well, so it will have drug interactions by increasing plasma concentration of warfarin, phenytoin, rifabutin, etc. Lastly, the side effects of chloramphenicol. Firstly, bone marrow suppression, as I first mentioned. It can be dose dependent or non-dose dependent. Dose dependent will be anemia, leukopenia, and thrombocytopenia, while non-dose dependent can be idiosyncratic aplastic anemia, which is fatal usually. It can also cause hypersensitivity reactions. Chloramphenicol can cause GI distress and superinfections with C. difficile, etc. An important side effect is gray baby syndrome, because babies or neonates do not have glucuronide transferase enzyme in their liver and are not able to metabolize the chloramphenicol that is administered, so it will accumulate in the body and also displace bilirubin, leading to kernicterus and also an ashy skin, nausea, vomiting, abdominal distension, poor suckling, cyanosis, irritability, circulatory collapse, etc. Lastly, the resistance modes to chloramphenicol can be various. One can be a change in peptidyl transferase, that is the binding site on the 50S ribosomal subunit. Secondly, it can be inactivated by bacterial inactivating enzymes such as acetyl transferases, and also by decreasing the permeability of porins by changing their size or shape. That's all about chloramphenicol.